we'll go over some of these. The outcome from that injury, though, it depends on several factors. These are intuitive. The type of injury, whether it's just simple compression or compression to provide, to the extent that the underlying tissue becomes hypoxic or ischemic, so that the degree of injury is quite variable. The severity, duration, obvious. Duration of injury, you can think of things like, well, if you have strep throat and you produce antibodies to strep, and those antibodies clog your kidneys, that's called strep-induced glomerulonephritis. But you got treated for the strep, the antibodies went away, and you got over it. So the duration of injury in strep-related glomerulonephritis is weeks to months, versus if you have a disease that produces antibodies, autoantibodies, all the time, and those autoantibodies are always there, you're going to wind up with renal failure. In the strep case, you had renal failure, but you got over it because the insult was short duration. In certain diseases like Sjogren's disease, you don't need to write that down, but connective tissue diseases, you're producing antibodies all the time, and renal failure to those is more severe. The duration of insult is different. And the type of cell being injured. Some cell types sustain injury better than others. We know that about the liver. You can take out 85% of the liver and it'll go back. You can bruise the skin and within a couple of weeks, it's back to normal. The nervous system does not tolerate injury. The central nervous system doesn't. If you injure it, it doesn't regenerate. If you injure it slightly, it can recover, it can adapt over time. But if you destroy the nerve, you're done.
What is scar tissue considered? The same tissue, just different orientation?
Scar tissue, depending on, so do you have a specific place for scar tissue? Okay, if you look at, let's take the example of type of cell being injured. Some cell types sustain injury better than others. You can infarct the liver, and it will regenerate over time. If you infarct the heart, the muscle cells die because you cut off the blood supply, and they're replaced with scar tissue. So that adaptation is less. Cardiac output goes down, ejection fraction goes down. You're not dead. But you're not going to regenerate myocytes. That would be an example. Some scar tissue like here, and people vary. People vary a lot with scar tissue. Some people, you can cut them, and they will, you come back 6 months later, and you can't tell where the cut was. So you had scar tissue that remodeled and regrew. But other people will form keloids. It's an overgrowth of scar tissue. You got one of the, you form keloids that is not normal. I have, when I was a young kid, I fell through a glass door, and I've got a little keloid right here. If you look at Amber Hicks upstairs, she's got a keloid right here where somebody took a mole off and she formed this keloid. She named the keloid because it was a hell of a lot bigger than the original mole. So, anybody else have a keloid? You have a keloid? Is it in a suitable place for a show on your ear? You got a better one,
Mine's on my knee.
like from knee surgery or something?
No, I fell and I needed stitches, but I didn't get them.
Yeah, so that would be an example of, oh, look at this horrible looking thing.
When I was moving, I sliced my leg open on a dish that broke. I keloid really bad.
So that's something, if you're going to keep this in mind, if a person comes in and says, you know, I have a,
one for the mole.
oh, yeah. So keep this in mind, if a patient comes in and with a spot on their face, you know, I'd like this mole removed. I'm not gonna do that, I'm not gonna take it off. Because if they're a keloid former, you don't want to do that. The outcome's going to be worse than what you started with. And there are ways to prevent keloids. Like if I was going to take something off of you voluntarily, I'd take it off, and then every couple of weeks I'd inject it with steroids to decrease the inflammatory response. So,
Is that considered metaplasia?
no. No. Metaplasia would be a specific tissue that changes character. This would be cellular repair. The proliferating cells here in this are going to be fibroblasts, but they're still going to be fibroblasts. And endothelial cells that have to come in to repair it. But they're still functioning endothelial cells. Remember, metaplasia is a non-functioning type of tissue. I mean, it doesn't have the same characteristic function as the original tissue. Cell injury, so this is interesting here. The different, often characterized by intracellular accumulations. These accumulations can be normal products of cellular metabolism. They can be abnormal products that were eaten from the outside, like asbestosis. You know, if you're exposed to asbestos fibers, those asbestos fibers are eaten by the macrophages in your lungs. They get in your lungs and they cause mesothelioma. Mesothelioma, that's a characteristic tumor of asbestos exposure. They mutate the cells and form this cancer. But that's from an accumulation of phagocytosis from something in the environment. Pinocytosis or pinocytosis is, phagocytosis is if you have something like a fiber or a bacterium and the cell engulfs it. Pinocytosis is if you've got the surface of the cell and it just pulls in little droplets. That's the difference between those two processes. Nuclear changes also occur as a response to injury. Like the nucleus, instead of being central to the cell, it will move off to the side. It becomes eccentric. Well, I'll show you some examples here. Signs of reversible injury. These are all different signs here. Let's go over each one of them here. Cell swelling. If this is the normal hepatocytes right here. Normal hepatocytes are arranged in rays. There's a central canal, and then they're arranged in rays going out from that central canal. And these hepatocytes over here, these are damaged hepatocytes. You see that they're enlarged, they're foamy looking. It's called hydropic change. They take on water, they swell. You can see right here in this part, all this swollen hepatocyte. This is the liver over here as well. These cells, and if you don't stop drinking, if you don't get over that hepatitis viral infection, they will die. But they are damaged right now. Fatty change is if you if you're a drinker, over time, your liver is going to take on, start accumulating fat within the hepatocytes. Normally, the hepatocytes store glycogen, but you're going to start storing fat. And this histologic slide right here, this is a stain for lipid. You can see there's a ton of lipid within the hepatocytes. A fatty liver is something that you can see on ultrasound. You can feel it as an enlarged liver, and they look different. Now, people will develop fatty livers without alcohol. It's almost a normal part of aging, a fatty liver to a certain degree. So you'll see that a lot of times on ultrasound reports that there's decreased echogenicity. The ultrasound waves move through tissues differently if it's the dense normal tissue versus this fluffy liver. So they can tell this is a fatty liver. And they can characterize it as mild, moderate, severe fatty liver. They'll give you the size of the liver to know, which they're really not that big, but you know what I mean. If you quit drinking, that's good. If a person comes in and they're an alcoholic and they're showing signs of cellular damage due to the alcoholism, and they have a fatty liver, this is more for you to tell them, you have to stop. You are damaging your liver beyond repair. Okay. One of the hardest things last year when we were going to Good Shepherd, we had this alcoholic who had hepatitis C. He was a mess. And he was just a raging alcoholic, and he had no desire to stop. And he was obviously, he may be dead by now, I don't know. But it was the hardest thing for the PA student that was there you cannot fix this man. He is going to die by his own hand. You can't fix him. And I think she probably had some nightmares about that. It messed her up a little bit. But it's just the way people are. Paul?
Could the reversal process be quickened by fasting?
Fasting?
Yeah, as in like going without food.
I don't think so. This is a process that took years to develop. If you were to recover from a fatty liver, it would take years. So if you recovered at all. You know, a fatty liver, I've never had a patient live long enough that their fatty liver went away. I'm not even sure it will. You know, by the time you have this fat stored in your liver, that may be it. And of course, the cell is not functioning like it's supposed to. So you're going to wind up with elevated bilirubin and, jaundice and all sorts of things that are related to it.
Does it at least improve, or is
It is, what happens with most of these cellular injuries is if you stop the insult, you'll stop the progression of the disease. Like when you have paresthesias down here because of diabetes, or if you have renal function, or your retina you can't see because of diabetes, they're not going to get better. If you have tight control, you'll just stop the progression of damage. And that's kind of the way it is with fatty liver.
I might have missed this, but why does it store fat instead of the glycogen?
Glycogen is a temporary thing. Glycogen, unless there's a storage problem with glycogen, I'll talk about later. But glycogen operates on an hour-to-hour basis. This is a chronic thing. I mean, you get fat from carbohydrates. So the cell is probably changing its metabolism to make fats from the glycogen is taken in. Here's the carbohydrate right here. McArdle's disease, there are a whole bunch of diseases. They're called glycogen storage diseases. The hepatocytes, and these happen to be fat cells right here, I think. Well, no, these are muscle cells. You don't store glycogen like you're supposed to. It accumulates, and if it accumulates, it impedes normal cellular function. And there are a whole bunch of, if you look at the production of glycogen is stored in the liver and skeletal muscle. Those are the two primary places. Also, the fat cells use it to make fat, adipocytes. But these people have a weakness. They're really the biggest thing. Now, protein accumulations, there are certain proteins that are byproducts of metabolism. One of them is amyloid, and I think this is amyloid right here. Amyloid, I think, is a 37 amino acid peptide. You might want to check that. But it's a byproduct of protein metabolism. You see it a lot in the pancreatic islets. It's thought to actually be a cause of diabetes, poor insulin production, because it clogs up the islet cells. You see it accumulating in the glomerulus of the kidney, like that. If it does that, you're going to decrease kidney function. There's actually a drug called Symlin, Symlin, that is an amyloid related drug used to treat diabetes. So look up Symlin. Okay. But the presence of protein here is thought to impede normal function. If you look at the central nervous system, the tau, T-A-U protein, the plaques and tangles of Alzheimer's disease, these are protein concretions that develop in the nervous system, believed to be responsible for, I don't know if it's cause or effect, but it's present in Alzheimer's disease. Exogenous pigment, we talked about it in a lab, that if you lived in a city, you breathe all that garbage, and it winds up being manifesting itself in the lungs. You can see it on the surface of the lung. If you look at a coal miner, the lungs from a coal miner before OSHA, black lung disease was the disease they got. Coal miners' pneumoconiosis is the official term. P-N-E-U, pneumoconiosis. If you look at the lungs, and they're just completely black. If you Google images, they're completely black. And if you look at sections through the lungs, the normal alveoli in the lung, they're just broken down. There's no respiratory component. These people died a horrible death. And so that's not going on in the United States, but I guarantee it's going on in other parts of the world where there's no OSHA. Endogenous pigment accumulation. Lipofuscin is a byproduct of lipid metabolism, and it produces a yellow-brown pigment in histologic section. You can see it here, right down here. You can see it, not these red things. These red things are red blood cells, but you can see it right here. This is sort of known as the age-related pigment. The older you are, the more lipofuscin you see in tissues. Now, that's believed to be, by many, part of the inability of these tissues to function properly. So, you know, if you take things like renal function, your normal glomerular filtration rate is 120 milliliters per hour. That's your normal. But after the age of 20, for every 10 years, every decade, your filtration, your GFR declines by 4. So you're the best you're ever going to be right now in terms of your kidney function. Every year after that, your GFR, every 10 years after that, your GFR goes down by another 4 milliliters, or you know, roughly 3%. So, melanin is another one. You know, normally it's in melanocytes, but it should not be anywhere else. If it is, it's melanoma. You can see here, here's the normal, in this epithelium here, there's the basement membrane right there. What are you doing with melanin producing cells all down here below the basement membrane? Well, that's metastatic melanoma now. Hemosiderin is a byproduct of hemoglobin, or more specifically, the heme component of hemoglobin. Heme contains iron. Hemosiderin is an iron-containing pigment. These macrophages are loaded with hemosiderin. You see that color right there. These are the macrophages. One of the cases where you get an excess in iron will be if you have an excess turnover of red blood cells, like some type of hemolytic anemia. Hemolytic anemia means an early breakdown of red blood cells. Ordinarily, red blood cells live 120 days. Sickle cells, a person with sickle cell, they live a matter of days. So you have more iron to deal with in sickle cell, you can't process it, and you wind up with hemosiderin. There's another disease called hemochromatosis, right there, hemochromatosis. I skipped a slide, we'll go back. So your normal hemoglobin content in your blood is, for a male, about 15 grams per deciliter. 15 grams per deciliter. If you're female, it's around 12, okay? Hemochromatosis is a genetic disorder affecting mostly males where you have an excess in red cell production. So instead of a hemoglobin level of 15, you have a hemoglobin level of 22. That excess iron produces hemosiderin. It destroys the pancreas, it destroys the liver. So here's hemosiderin in the liver. This is not good. The treatment for hemochromatosis is simple. It's just every month you go in and give blood. You keep your hemoglobin count down to normal values and you won't have any problems with it. Here's endogenous pigment accumulation. Normal liver over here on the left. And by the way, I love chicken livers. Y'all love chicken livers? You know, you go someplace and in North Carolina, you know, redneck hillbilly capital, you know, the United States. When I was a graduate student, we ate, this was before ramen. If you really want to have a cheap meal, you could buy those Jiffy cornmeal mix boxes for 10 cents. You just add a little water because we didn't have any eggs or milk. You add water and you just eat the raw batter. And I mean, we were starving. But the other thing is there was a barbecue place when we could go out to eat. There was a barbecue place that had, you know, barbecue. But that was like real food. But then they had, as a byproduct of the barbecue, you know, the chicken and stuff that they had chicken livers. They had a billion, you could get 1 billion chicken livers for like $1.99. And I mean, the plate was just piled up that high. And oh, anyway, has nothing to do with this. The only good thing for this liver is to go use it for catfish bait. But anyway, I got off subject. If the liver is not functioning properly, then you wind up with bile pigment accumulation which is bilirubin in the circulation. And I'll go through later on during a lab medicine, how you get from the spleen with processing hemoglobin to bile and that whole pathway. But suffice it to say, if you cannot process the heme from the spleen, and it winds up as an increased bilirubin in the circulation. Bilirubin is a pigment, a bile pigment. You saw that greenish, gallbladder. That gets into your circulation, gets into your cells, and turns you yellow. That's jaundice. It also affects your sclera. It turns your sclera yellow. That's icterus. I-C-T-E-R-U-S. Icterus is yellow sclera. Jaundice is yellow skin. When the pigment gives, so the normal the normal bilirubin level in your circulation is 1 milligram per deciliter. When it gets up around 3 or 4, when it gets up around 2 to 3, you start turning yellow. When it gets up around 4, the presence of this bilirubin in your skin, it's itchy. These people are just itching to death. I mean, they really just, irritating to the skin. Okay? Yes, ma'am.
So can you stick people that have like the liver issues with jaundice under the blue light, like in babies don't go away?
Billy lights in babies, a completely different mechanism. Their issue has to do with being able to metabolize bilirubin. They lack the enzymes initially. Iron and bilirubin products are high in mother's milk, breast milk. So after birth, many babies will turn jaundice. Neonatal jaundice is common. One way to fix it is you expose them to high intensity light, and the ultraviolet light will break down the bilirubin in the skin, and they will, their bilirubin level will go down. The problem with a high bilirubin is it destroys neurons. So you can wind up with nervous system disorders because of elevated bilirubin. In adults, that does not work. Bilirubin lights don't work in adults. Also in kid, if the neonate has neonatal jaundice, you want to make sure you take them off breastfeeding, put them on formula for a week or two till the bilirubin comes back down, and then they can resume breastfeeding when they've developed the enzymes needed to break it down. Okay? But yeah, it'd be nice if you could stick a person under Billy lights, but it doesn't work. I don't know if it has to do with how thick the keratinized skin is in an adult or what, but it doesn't work in an adult.
So does it still cause the CNS damage?
The what?
You said it destroys neurons in babies. Does it destroy neurons in adults?
Not in the same mechanism.
Okay.
When you have cirrhosis with jaundice, you're going to have central nervous system disorders more related to the alcoholism than anything else. Now, if you have jaundice because of hepatitis A is a self-limiting disease. It's like a cold, it's like the flu. You're going to get over it. But I've seen some pretty jaundiced people with hepatitis A, and it has no effect on the central nervous system. They do itch, but it has no effect on the central nervous system. Eating uncooked seafood like raw oysters, that's really sushi or sushimi, or one of them is uncooked. I can't remember which one.
Sashimi.
Well, I guess they can both be cooked or uncooked, but raw seafood there was a years ago, almost 30 years ago, there was a restaurant, a Cajun restaurant up on Western, and they had a employee that wound up with hepatitis A working in food preparation. And then, so there was a big public health scare of all these people that could be possibly infected by this guy in the restaurant. It didn't last, the restaurant didn't last long. It was good food. I got a letter in the mail and said, hey, you been exposed to hepatitis A. Hey, okay. If it's hepatitis B or C, I'd be a little concerned. Hepatitis A is like, you know, you got the flu. Any questions about anything going on in your life right now? All right, go eat and come back and we'll talk some more.